All right, thanks, Ryan. Skiing and snowboarding are fun winter activities, but along with the fun comes the risk of injury. Here today to talk about those common winter sports injuries and how to prevent them is Dr. Kristopher Ware, an orthopedic surgeon and sports medicine specialist at the Hartford Healthcare Bone and Joint Institute. Doctor, welcome.
Thanks for having me.
Thanks for being here. So have you seen an increase in winter sports activities in the past years?
Over the past year and a half, we've seen an increase in sports-related injuries in general, and I think that's in part due to the rapid shutdown of sports because of coronavirus, and then a rapid return to sports, and in some cases with the athletes not being fully conditioned yet. As far as winter sports-specific injuries, we have seen a recent increase, or at least a trend in increased injuries, likely because the conditions in New England have been more favorable recently for sports activities.
All right. Doctor, what are some of the most common types of winter sport injuries for skiers?
For skiers, we see in the orthopedic world, we see a lot of knee ligament injuries. So ACL tears, MCL tears are very common. In addition, we'll see injuries, fractures around the knee, especially if the bindings don't release. We see wrist injuries, shoulder dislocations. Those are probably the most common.
All right. What are the most common injuries for snowboarders?
So snowboarders, the injuries tend to be a little different than in skiers. There's a higher risk of upper extremity injuries as opposed to lower extremity injuries in snowboarders. So more commonly, we'll see wrist fractures, shoulder dislocations, as opposed to knee ligament injuries, probably because the snowboarders have their both feet fixed on the snowboard other than when they're getting on and off the lift. For the snowboarders that are riding in the park, taking big jumps, we do still see fractures and knee injuries from that as well.
All right. Do you have any recommendations for preseason preparation?
Yeah, the importance of ACL prevention programs and conditioning programs, it's gained increased recognition, and there are some studies that have shown a significant decrease in ACL injuries with a preseason ACL injury prevention program. Those programs are designed to improve coordination, improve balance and strength, and improve landing mechanics. In addition, I think it's important to work on general conditioning and endurance because we know that fatigue plays a significant role in the risk of injury.
All right. What are some tips for injury prevention real quick?
So I think first is make sure that your equipment is well tuned. You need sharp edges. If you lose an edge, you're likely to be injured. Wrist guards in snowboarders can be helpful. As we said, the preseason conditioning, and then don't push your limits, especially at the end of the day. We know that the injuries are higher in the later afternoon, and so for the last one or two runs, those should really be your easy runs.
All right, Dr. Kristopher Ware, great advice. Thank you for joining us.
Thank you.